Hasn't there been in the last, I don't know, 10, I'm not sure when it started, 10, 15 years perhaps, this sort of gigantic focus on STEM careers and the future of STEM and how and critical and important it is, which I certainly don't wish to undermine. But are you saying that that hasn't worked, or that that effort has been not enough? Well, how would you couch that given the reality that we're now suffering through?
Yeah, I think there's a couple problems with it. I think you're right. Like we have really tried to double down on STEM careers. I think the problem though is that not everybody is going to do STEM. And oftentimes they think about STEM careers as like career pathing. So for kids who show an early interest in STEM, of course, science, technology, I don't know what the E is, and math, then they push them into those career tracks. And then for everybody else, there's this sort of sense of like, oh, well, I guess you don't have aptitude for science and math. So you can get tracked elsewhere. And I think instead, the way that we should have been teaching science from the jump is as a way, as a method of inquiry that everybody can have access to and everybody needs to have a baseline knowledge and understanding of as we engage in the world around us. And I think the challenge that we have is that because of that sort of two tracking thing, for the vast majority of people who don't end up in a STEM career, they're not just left with less information, knowledge, and engagement with the subject, but they're left with the idea that somehow this is not for them. And I actually think that that's a real problem. So I think rather than thinking about STEM as a career pathing exercise, which a lot of our education has done, I think we should be thinking about STEM as it's foundational. It's like learning how to read and write and do very basic math. It's just like this is just what you learn in school. And I think if we did it that way, I think you'd have a lot more folks finding their aptitude and their engagement in it, and also a lot more baseline literacy in science, technology, whatever E is, and math.
Um, is it engineering? I don't know. Actually, I'm
Engineering. I should know this.
yes,
My
yeah,
parents are engineers. Yeah.
yeah.
So
Fair enough.
my bad.
But
Sorry, engineers.
if I may, given your expertise, you actually wrote a book on Medicare for All. I'm sure, as you're well aware, a Big Beautiful Bill Act is, by some estimates, going to kick, because of a change in eligibility and work requirements around Medicare, it's going to kick about 17 million people off of their, essentially their insurance coverage, which really got me to thinking, like, it's not, I mean, as dire as it is, it's going to get significantly worse, particularly for rural hospitals, but not just them. Which leads me to ask sort of a two-pointed question. One, in your best assessment, why has Medicare for All failed politically? Secondly, is now a more fertile time for it? And if so, why?
Yeah, I think I'm going to reframe your first question to say, why has it not yet succeeded? And I think the reason it has not yet succeeded has a lot to do with the way that money sloshes around our politics. Every single time we've tried to do meaningful health reform, and not just Medicare for all, right? Think back to the Clintons. Think about the Obama era ACA reform. There has been huge efforts by some constellation of big pharma, big insurance, big hospitals, spending insane amounts of money to fearmonger the public about what they will lose so that these corporations and industries can continue to make huge amounts of money off of us when we get sick. And they have architected a system that isn't just at steady state bad, it is getting worse every single year. Our premiums here in Michigan on average are going to go up double digits in Michigan. And that's above and beyond, right? A deductible that is like what, on average of 4,000, and they hide behind these stupid words. So let me just explain for folks who aren't paying attention to what a premium is. There's nothing premium about a premium. It's the way your paycheck gets garnished every 2 weeks or 4 weeks to pay for your baseline insurance. And then a deductible, which again has no definition outside of the insurance industry, is the money you pay after you've already paid every 2 weeks or 4 weeks to get the healthcare you thought you already paid for. All of those are going up. Like the median deductible for a family of four is $4,000. And if you're doing the math, the median family of four makes about $80,000 a year. So if you put those two things together, that means that you have to lose a whole paycheck, even though you give money to the health insurance CEO and his company every 2 weeks or 4 weeks. You go without a whole paycheck to get the healthcare you thought you already paid for every 2 weeks or 4 weeks. It's insane. And it's just getting worse. Our waiting times are getting worse. The hospital consolidation and the choices that you end up having as a function of it are getting worse. And people's experience is just deeply frustrating. And so I think that we are walking into a moment where the MAGA movement has overplayed its hand. They're gutting Medicaid, it will cause the demise of rural and urban hospitals as a function of that. So even if you're somebody who's not on Medicaid, you also may risk losing the hospital you otherwise would have taken your private insurance to go and get healthcare at. And then they're doing it for the purpose of passing a tax cut that still adds $3.5 trillion to the national debt. I think this is a moment where we have an opportunity to finally actually get this right. I would rather tax wealth to pass Medicare for all. I think that would be vastly to the benefit of the American public. Now, here's the thing about it. Part of the reason you're not hearing Democrats say what I just said is because too often they're bought off by the same corporations that Republicans have been bought off by. And that's why it kind of all goes back to corporate money and politics. So long as you've got members of Congress taking PAC checks from big healthcare corporations, they're not likely to be talking about Medicare for all because, of course, they'd be biting the hand that feeds them. I've never taken corporate PAC money. I never will. And so it frees me up to just talk about the things that I think would be in the public's interest. Now, as this problem gets worse, I think voters are going to continue to bolt from a party that is not answering to their demands. And we're seeing exactly that. You want to know why the Democratic Party's brand is so far in the toilet? I think this has partly to do with it.
Can we talk about what the estimates of cost would be? And to the best of my knowledge, I again, this is why I'm kind of leaning on you a little bit to see what that would look like. I have looked around and seen like the Rand Corporation came up with a budget or what it would seemingly look like. I know there was a very controversial one from the Mercatus Center. We don't have to talk about theirs, but the point being is that I know that my understanding of your position is that, listen, how do we pay for it? We're already paying for it. We already are paying it in the way that we do. But practically speaking, A, can you give me a sense of what that budget would look like? And B, from the more practical sense is how would Americans, how should they understand how they would interface with those costs day to day? What would that look like in their paycheck? What would that look like at the point of care? Unpack some of that for us.
So, Luke, let me give a little explanation quickly of how the system works so that I can answer the question. Right now, you have basically two large industries that make up healthcare. You have payers; they're the folks who are your insurance company, and then you have providers. Right, providers are the ones that actually give you healthcare. So clinics, hospitals, to some degree, pharmaceuticals. You actually ask them for healthcare that you actually consume. Okay. The way this generally works is that you contract, or your employer contracts out with a payer. You get your paycheck garnished. And then when you get health care, the payer then pays the provider for that care. The challenge with that system right now is because there are about 700 payers in America. No one of them has the power to actually hold any of the providers accountable when it comes to price increases. And so not only do we pay more in our country than any other high income country in the world per capita. So to give you an example, we pay about 19 cents on the dollar for every dollar spent in the entire economy on healthcare, compared to Canada, which is about 11 cents on the dollar. They live 2 years longer than we do. And in survey after survey, they're happier with their system. But not only is it the most expensive, it's the fastest increasing in price because there is no real accountability in the system. So when people talk about Medicare for all, the other technical name for it is single payer. So instead of having all these payers here, you have one payer. That payer is the federal government, which, by the way, has proven it can do this very well because it does this on behalf of the people who need the most healthcare in our society, who are, by definition, people over the age of 65, right? Like those are the people who tend to consume the most healthcare. So the government can do this and do it pretty efficiently. And so because you have a single payer for everyone, it can then negotiate the prices of care on behalf of all the people who are beneficiaries of it, you and me. And when that happens, it can start to curtail the incredible radical increasing price that we all are finding every single year. And because the overhead of Medicare is about 3% compared to the overhead of the average health insurance company, which is about 15 to 18%, we lose that extra cost off the top immediately. And because it's one payer for everyone, you don't get priced out of health insurance. You don't have to worry about health insurance transitions. I mean, all the reasons you can lose your health insurance in America, you turn 26, you get married, you get divorced, you get a job, you lose a job, you turn 65, right? That all goes away because from cradle to grave, hopefully long after a long productive life, right? You have one insurer. So basically it's like having healthcare citizenship, and you can take your citizenship into any private healthcare provider in the country. So it's not a nationalized takeover of healthcare. It's more of a national takeover of health insurance, which offers zero additional value, zero additional innovation, and fails to do the one thing insurance probably could do well for us, which is keep healthcare prices down. So what's the experience? Well, you get born and then you are on Medicare. And whenever you need healthcare, nobody tells you can't go to this hospital or that provider because they're in network or out of network, which, by the way, is a fancy way of saying the insurer and the hospital have negotiated sweetheart deals with each other to support each other, right? That goes away. And you will know that regardless of your situation, Medicare will have you covered, right? In the vision that we have, it's zero copay, zero deductible, right? Zero out-of-pocket costs at the point of care. Right now, depending upon what kind of insurance you have, your copay, your deductible, your premium can be all over the place, right? And you don't have to worry about losing it. So if you lose your job or you decide, hey, I got this amazing idea, I got $1 and a dream, I want to start an amazing business, go and do that, right? And little Timmy, your kid, doesn't have to worry about losing their asthma inhaler because you lost your insurance when you decided to go start your small business. So it frees up a lot of folks' experience. Now, I want to talk about cost for a second, because the problem with it is when you start saying this is how much it costs, everyone's like, well, you want to add that to the federal budget? I'm saying I want to take that out of your cost budget personally. And instead, I want to be able to trade that into the federal budget to be able to save you from the exorbitant costs, the risks of medical debt, all of the things that come with the risk of losing your healthcare in this society. And so, yes, it's expensive, but right now, I told you the cost of healthcare in this country is 19% of our GDP. So if you could bring down the cost of that by taking out the overhead, if you could address the fact that it's inflating faster than the rest of inflation, which God knows is terrible, and you could make sure it was stable and affordable for every single American, I think that's a damn good deal. And I think if it's explained that way, the American people understand it's a damn good deal, because right now we are getting fleeced. We're getting fleeced by the providers. We're getting fleeced by the insurers. And a lot of folks are going without the healthcare they need. And a lot of other folks are getting the healthcare they need and then falling into medical debt because of it.
Hey guys, thanks for watching the video. Please consider giving this a thumbs up as well as liking it. And if you want more of my politics coverage, go to the link in the description box for my Substack. Yes, go to my Substack. We might put a QR code on the screen here as well. Tons of exclusives, interviews, chat functionality with a whole different community over there. Tons of fun stuff. Give it a look.